I am extremely passionate about this subject, so let's talk about it. Back in the day, women used to drink Guinness when pregnant because of their low iron. So it's not just a me thing or in Europe. I think women in America used to do the same thing with beer. And back in the day, everyone was smoking and no one thought it was toxic for the unborn baby. So there's a lot of things that were done back in the day that obviously we don't do anymore. Now, the medical field in Europe is completely different than America. In Europe, we focus on diet, lifestyle, and exercise first and foremost, and try to always find the root of the problem. In America, everything is about pills and medication to try to cover a wound. It's like putting a bandage covering a wound. They don't try to clean the wound and try to figure out where does that wound come from. I am a French medical interpreter. That means that I'm every day 8-10 hours a day. I'm in the clinic, on video, or in the phone, in the hospital, in the ER, neurologist, cancer patient, people dying, anything, name it, I've done it, okay? And I see it from my own eyes how in America the medical field works. And because my parents, my mom was a nurse and my dad has his own business and work in the hospital every day, I've seen the real medical field in France. And so the difference is in America, everything is about the pharmaceutical company that is the king and everything is about pills. When I'm at work every day and people come because I have a headache, what does the doctor do? Pills, pills, pills. How about how many hours a night do you sleep? How about how many liters of water you drink a day? Because most of the time, people don't sleep and don't even drink water, which is the reason of why they have a headache. But no, everything is about pills in America. In Europe, we're gonna try to see the real reason of why you have a headache and fix this first. This is why my parents don't believe it, but it's not the right word. I saw it in the comments, someone used the right word, which is in Europe, we do not abuse medicine. In America, people abuse it so much, it is freaking insane. Every day at work, kids are put on ADHD meds. For what reason? Because their parents let them watch screen all day long, give them sweets and all this dyes in their food, which then cause ADHD. But instead of trying to find the root of the problem, they just fix them with the ADHD pill. In France, that is not how we do it. We try to find the cause of the problem, and it's like, okay, that child is watching TV all day long, or that child is not getting enough exercise. He is not being entertained enough. He's eating too much sugar. Now, same thing with blood pressure medication and diabetes all day long at work. I do it every fucking day. People come and they have high blood pressure, and you know what? Instead of putting them on medication in France, we're gonna change your lifestyle. We're gonna tell you you have to exercise, you have to go on walks, which most European people do anyway already. So it's not as big as in America, but in America everyone has blood pressure or diabetes. Guess what? Because if their lifestyle was better, if they actually were better with their diet, if they were paying attention to how much sugar they eat, if they were actually walking every day and exercising, they will probably 99% of the time not be on those blood pressure medication and diabetes medication, because diabetes, the type 2 diabetes, it is curable, and most people don't know that. They just listen to doctor taking meds and like, yeah, just take this, take this, take this. And at work, you know what I see? People on like 5, 6, 10 medication for things that they could fix themselves with the correct diet, the correct exercise, and changing their lifestyle. If they will not be eating so much sweet and so much salt, maybe if the doctor told them, or they will go see a nutritionist and told them, okay, you need to change your diet, you need to eat less salt, like actually trying to fix the root of the problem, they will need the medication. And of course, there's some that you need medication, okay? If you have epilepsy, if like me, levothyroxine, I have to take for my thyroid. There's no other way around it. There is things that we do believe, but the problem is American people abuse it, and abuse it so much. At work every single day, take Tylenol and ibuprofen just because they think it was gonna make them feel better and it's gonna give them energy, like it's a caffeine pill. It's like insane. And then they wonder why they always have an ulcer in the stomach. Excuse me? The same way that pregnant women abuse Tylenol instead of drinking water. There's 5% of the doctor I work with that are very good and that would actually ask the pregnant woman, how much water are you drinking? Guess what? Small 2 glasses per day. No wonder they have a fucking headache. And that same great doctor is gonna tell the pregnant woman that complained that she has cramps on her belly, that she is dehydrated. That's why she needs to drink more water so she doesn't have cramps, instead of taking Tylenol. everything is related. Instead of like just taking medication like it was candy in America, in France and in Europe, we actually pay attention to lifestyle and diet and walking outside and doing exercises. Now, there is a middle ground between what my parents and what a lot of people believe in Europe and America, okay? Even my mom was saying, the natural is the better. You don't need to take all those medications. Listen, I did IVF. Natural is out of the question, okay? Progesterone, estrogen, aspirin, all of this, I need to be taking it in order for my pregnancy to work, okay? So you need to find a middle ground. They don't even believe in multivitamin or prenatal vitamin because in their mind, if you eat the right vegetable and the right fruit, you do not need to take a prenatal vitamin, which they are right. Prenatal vitamin, it's only because people lack those nutrients because they don't have the right diet, okay? I take it because I rather take it, but they are right in a way. Do my parents know about MTHFR gene and that you need folate for it so you don't keep having miscarriages? No, they don't. Now, Tylenol, pregnancy, 99% chance that I would not be taking Tylenol or any pain medication for that matter. There is research that's showing that Tylenol is linked to autism. I do not believe in Tylenol. I do not believe in pain medication. Yes, I've got this from my parents. I believe in exercising, walking, stretching. I was an athlete my whole life. I was a dancer for 18 years. I stretch every freaking day. You know what people have pain? You know why people have back pain most of the time? Because they are sedentary. They don't stay behind a screen. They stay watching TV all day long, and then they go work and they sit behind a desk. They don't walk like their body is made to work. Most of the time, all they need to do is actually go on a walk, stretching, because guess what? People that have all this pain, what they do beside taking pain medication is actually going to physical therapy. And what do physical therapy do? Exercise and stretching. Duh. So it's the same concept. I personally will not be taking any Tylenol. There's a 99% chance I won't be taking medication that I do not need in pregnancy if I can fix it with a natural way, meaning stretching. Same thing. Will I take metformin for my PCOS? No. I rather take myoacenetol and work on my diet. But there's stuff that I cannot do without, like aspirin. I can't go without my levothyroxine for my thyroid. So there is a middle ground for everything. But that is a huge difference between the medicine, Europe, and American, especially that I have lived in both. I work in an American field medicine now, and I've grown up with the European medicine. So food and exercise are medicine, and I 100% believe that. And in America, all the drug problem and the hard drug, it's only an American problem. We do not have this problem in Europe. So that also tells you a lot. So I feel like there's a middle ground that has to be found between people in the 80s, like my parents, what they were taught when they were pregnant, and nowadays in 2024. So thank you for coming to my pep talk.